Hello and welcome to webinar series. Myself Shanti, and today's very important topic for discussion is all about on epilepsy. And for this, I welcome our expertise and another Dr. Sagariji, who is our consultant neurologist and epilepsy specialist for adult and pediatric from Yashoda Hospitals High-Tech Unit. I welcome you, ma'am.
Thank you. Thank you for your kind introduction.
And we are all happy and honored to have you with us today, so that we have a new learning, thing going forward. Yes. And now I introduce all the speakers to introduce yourself. Yes, over to you, Krishnaveni.
Yes, good morning, good afternoon. Myself, Krishnaveni. I am working as a nursing tutor, so I am very happy to participate in this module, ma'am.
Yes.
Hello everyone. Hello everyone. Good afternoon. This is Princy Mathuri, nursing officer in Government General Hospital. I have 14 years of experience in ICU. I'm very happy to be here with you all. Thank you.
Yes, Tripti.
Good afternoon, ma'am. Myself, Trupti. I am working from Sri Ganga Hospital in Church, Nanded.
So yeah, thank you. Let us see what we have in the rest of this session, and we all will be learning from our expertise, none other Dr. Sagriji. So, ma'am, the first insight we would like to understand from your end is what is epilepsy in a very simple, terminology. Yes, over to you, ma'am.
Yeah, actually, seizure and fits both are one the same. Seizure is due to abnormal firing of neurons of the cells in the brain. That is a seizure or a fit. So, epilepsy is when there are two or more seizures in 24 hours duration, 24 hours apart. Then it is called epilepsy.
Yes, I think that was a very simplified way of making us understand what is the difference between epilepsy, fit, and seizures. Yes, going forward, over to you, Krishaveni.
Ma'am, what is the, I would like to ask the question regarding what is the exact cause of epilepsy, like genetic or environmental causes, ma'am?
There is no exact cause of the epilepsy. Most of the epilepsies are not genetic. Most of the epilepsies are not genetic. Most of the epilepsies doesn't have any cause. So what we see frequently in the pediatric age groups, genetic might be the percentage might be the high. But if you see in adults when 20, 30 years, genetic is the least common cause, and other causes may like there is no proper one cause. Like strokes and all, these all contributes only part of the cause.
Yes.
Actual cause, there is idiopathic cause will be there. That is the focal epilepsy. Focal epilepsy is the seizure in one part of the brain, arising from the one part of the brain, with
Yes.
MRI might be normal. That need not have any explanation or cause or genetic cause, anything. That is like we consider it as an idiopathic. So that is more common when compared to remaining all things.
Yeah, that's how I think it is a very important for us to learn, because a lot of the time we always have this misconception, and it is very good to have the clearance on myth
Yeah,
versus fact. Yes,
most of the seizures are not genetic. That's what
not
we have to
genetic.
understand. That is
Yes,
very important because like all people think it's like we don't have any family history, we don't have anything. Why? That's like most of the times it's not genetic.
not genetic at all. Yes, thank you. Yes, Tripti.
Ma'am, what happens during a seizure?
But in a very simple way, she wished to understand what happens during a seizure, ma'am.
So,
Yes,
like I told, no, there are two types. Broadly classification, I'll tell you. Generalized epilepsy and focal epilepsy.
yes,
Generalized is arising from the whole part of the brain. Focal is from the single part of the brain. This is a
yes,
broader classification.
yes.
So, like if it is involving one part of the brain, like frontal, temporal, parietal, occipital, we have four lobes
Occipital.
in the
Yes. Yeah.
two parts of the brain. So, if it is involving temporal lobe, some will have the semiology of only vomiting. They'll have
Yes.
the only vomiting, only minor auras, like they'll have some abdominal rising sensation. That's a seizure only. Few seconds they will not be responsive. No need to have all like movements like this. So that is a focal epilepsy. If it is involving posterior cortex, something, some colors seen before your eyes, one-sided, lasting for few seconds. Vomiting. Some people will have vomiting sensation and they'll vomit. During that time, they will be unresponsive. That's only few seconds. That is a
Yes.
kind of a seizure, lasting only few seconds to minutes. That you have to understand. Stereotypical, always occurring in a similar pattern. That is a kind of seizure. That is a focal seizure. So generalized, we all know that's having tonic-clonic movements with tongue bite. Everything we will have
Yes.
with the head deviation, eye deviation,
Yes.
or
So I think
yeah,
yes. So that is the reason I think many may have this, that nothing is happening with me. This was just fraction of second I vomited, and then need not to seek medical expert opinion like that. It may also happen. Yes. Yeah. And
Yeah.
yes, Princey.
Yeah. Yeah, ma'am, we have known that symptoms of epilepsy now, but in what ages, like people like pediatric or at any age epilepsy can occur, or is only particular age can epilepsy can occur?
it can occur at any age, from months to 50 years. New onset, I'm saying. They can arise
Yes.
from new onset. Even I've seen at 45 years, new onset. In the whole life, they can be normal. So that is a focal epilepsy only usually will present like that. Focal means involving one part of the brain.
Only one part.
Oh.
Yes. And what would be the causes for this new onset for the middle age? Any, or is it also like idiopathic?
So that's what I'm saying. Some people, idiopathic means they will have some abnormal tissue in that part of the brain, which can be seen in the MRI or may not be seen.
Yes.
So that is like we don't have a reason, no genetic, nothing.
Yes. Yes.
That will be there from the womb of the mother only, but the presentation will be in the different ages.
Yes. As you were talking about the aura, and many of us, we have no idea about what is like a kind of aura, or is it considered as a warning sign? Say, because sometimes, as you were saying, the patient may have aura, sensory changes, muscle twitching, all this. So, is it also been taught to the client, the new onset client, or the one who is experiencing these? Because you may see pediatric group or the adult child who goes to the school, is it been betrayed to the child that this experience, this aura, if at all it is experienced, you can just seek medical, opinion, or just stay safe wherever you are? Yes, ma'am. Over to you.
Yeah, and few symptoms, any abnormal taste or any abnormal smell or any abnormal sight of one object lasting for few seconds to minute with some partial awareness,
Yes.
always coming in a similar manner, stereotypically, means repeatedly coming with a similar manner, then we have to consider as a seizure unless otherwise proved.
Yes. Yeah. Yes, Krishnaveni.
Yes, ma'am. For epilepsy patient, consciousness is restored immediately after getting a seizures, ma'am, or
Yes,
few
very good
returns within
question.
minutes. Yes, ma'am.
Yeah, very
Thank
good
you.
question. Actually, the seizure, with a generalized seizure, big seizure, generally they will not regain consciousness immediately. It will last, like they will have some confusion after the episode, almost for half an hour. But what I'm telling you, the focal seizures, very minor seizures, they will be normal immediately. That few seconds only, they will be partially aware. Some people might be aware partially also. It need
Yes.
not be like always complete unawareness.
Yes, Ripti.
Ma'am, how is epilepsy diagnosed?
Yeah, very good question, because people will think MRI is normal. All will be
Yes,
asking
yes.
me MRI normal, EG normal, everything is normal. That is what is the importance of an epileptologist. Epileptologist is a neurologist only who's trained in epilepsy, is an epileptologist. So what is the importance is EEGs generally will be done for few minutes, like 20 minutes to 40 minutes. MRI can be normal, EEG can be normal, but we have to do long-term EEG. Long-term EEG is what we do is like 12 hours to 24 hours also sometimes, even 2 days also. If we have a strong clinical suspicion of seizure, that is most accurate diagnostic tool than any other things of MRI or short-term EEG.
And as per the impression, we provide the target interventions, I guess, ma'am.
Yes. According to that, like, yes, if it is a focal seizure, the choice of drugs will be different. If it is
Yes,
a
yes.
generalized epilepsy, it is different. So always it is important, not only for the diagnosis, for the appropriate choice of the drug and for the future prognosis, long-term EEG is very
Yes.
important.
Yes. Very great to understand your productive insight on the same, ma'am. Yes. Yeah, over to you, Princey.
Yeah. Ma'am, about deep brain stimulation, that Yashoda is very famous in deep brain stimulation. What kind of seizure type can undergo to deep brain stimulation?
So this DBS and VNS, both vagal nerve stimulation, these are the procedures to prevent. These are not curative methods. Curative means to cure the epilepsy. For the focal epilepsy, we have a wonderful option. Like almost for around 50 to 60% patients, we can cure the epilepsy. If we try to localize the lesion, MRI might be normal outside, but we have to
Yes.
discuss with the neuroradiologist and good epileptologist has to see with the video EG. Means we have to capture the event and see from where it is coming, and we have to do MRI, good MRI with epilepsy protocol with PET. All investigations combined. If it is coming from one area, then we can cure the epilepsy by resection, that removal of this area. So if that is not possible, and if it is coming all over, then at last option we'll consider as DBS and VNS. These are not curative. This will prevent the big seizures, unwanted falls, injuries, big seizures, but this will not cure the epilepsy. We have a curative options too. In 50 to 60% of epilepsies, we can cure the epilepsy in focal epilepsy.
Yes. So yes, going forward, and we are also, here to understand what should be few preventive or careful steps while we should take, like if the seizures or fits happening in the outside hospital scenario, ma'am. I have quoted few points, as you said, 2 to 3 minutes it lasts, or it might, last for. I think these are the points which
Actually, that
we're
is very
trying to.
good. Actually, you have to keep him left lateral side and
Yes.
everything to be avoided. Nearby objects and all dangerous objects to be removed. And for the any mouth, if something is there, you have to remove that. If there's something in the mouth, remove it. That don't. And one more thing is you should not try to stop the movements. You have
Yes.
to
Yes.
leave him alone, and you should not keep anything in the mouth. And one more important thing is so surroundings any major object, or he has to be safe because he should not have any injuries.
Injuries. Yeah.
So, and one more important thing, you should not panic. Seizure will not cause any death. Seizure will last only for 2 to 3 minutes. If you keep some keys and all, it will not. It's like it is abnormal firing of neurons. Abnormal firing generally will subside on its own after 2 to 3 minutes. If it is not required to send him to the hospital immediately, also you have to make him feel comfortable, and then you can take him to the hospital.
Settle. Yes. Yes.
And if it is lasting more than 5 minutes, repeated seizures, then it is required to call help.
Yes. Yes. Yeah, very great point. Yes, sir. Princey, over to you.
What kind of treatment and epilepsy care to be given for epilepsy patients, ma'am?
Madam, we keep hearing about this keto diet also. We thought we will just have your opinion on the same because, yes.
Yeah. So ketogenic diet generally we consider for the young children, the pediatrics who we cannot treat. Means we will be seeing lot of epilepsy patients who are refractory to drugs. Refractory means on to more than 2 drugs. If they are not controlled, that we consider as refractory, and that is not focal. We cannot detect any lesion. Then we'll go with the keto diet, mainly in genetic cases like Dravet's, Lennox-Gastow's. Genetic type of epilepsies we go. Surgical option might not be the case in that. We go with the ketogenic diet, mostly in pediatrics. Adults we will not consider gen.
And yes, it is also important when to seek expertise help, ma'am. I try to, mention few. Any other parameters you would like to tell in this forum so that, the awareness is done? Yeah.
So what I feel strongly is that what is the importance of an epileptologist or post neurology? Why we are trained in? So it's not only for the surgical cases or refractory cases to diagnose with the multimodality. So every case has its own thing. Means you have to sometimes like expertise also can miss the seizure. I told now that vomiting sensation.
Yes.
They
Yes.
like vomiting sensation, only just vomiting sensation. Like probably might misdiagnosed by the other physicians. It's possible. So it's not only for the refractory or big cases. So every case has to. So we have to correctly evaluate the case, like with the good EEG. So we have to localize the lesion, means whether it is focal or not. Based on that, we can prognosticate the patient and give the correct choice of drug. Prognosis is very important for epilepsy patients so that they can they can continue follow-ups with you.
Yes. And one more, query I wanted to have, like we see many of our, maybe a middle-aged colleague also sometimes, they say the person, male and female, was a case of epilepsy. And then now I'm doing good and I've stopped the medication. But one fine day, we hear that the person fell down because he was not continuing, he omitted his medication. So what is, like, I wanted to understand here, what is the compliance rate to adherence to the medication, ma'am? Do you also see, the client comes to use that 1 to 3 years they were fine, they stop taking medications, and then again when there is a recurrence, again they come for your, help? Yes.
So that's a good question. Actually, that is what I'm telling. The prognosis of future. The most of the epilepsy is a focal, what we see regularly in adult patients. So those kind of patients, even though they don't have seizure for 2 3 years, that is only with the drugs. They were controlled. The seizures are controlled. So you have to prognosticate him prior only that focal epilepsy. There is no permanent cure with the. Generally, it's most of the cases there is no permanent cure with the medications. So if you try to diagnose the case initially only, so you will prognosticate all this aspect from the initially only. There is no
Yes.
guidelines, say, it means there are no proper guidelines to stop the drugs, like for after 3 years controlled epilepsy, there is no, like we have to stop the drugs. There's no proper guidelines for it. That is based on the type of epilepsy, based on the EEGs, on the regular follow-up only we can say.
Yes, we
So
can.
it is always important to go and meet a good epileptologist. Regular follow-ups are important and try to prognosticate early. As an epileptologist, what I do is I'll try to prognosticate early because the most of the patients expects they if they come second opinion after a neurologist to me, they'll expect that only. So what is the prognosis? Like after how many years I can stop the medication? So that is based on the regular follow-ups only we can say, and initial diagnosis whether it is a focal or generalized.
So no doubt about your clinical judgment and the, prevention for the same. Yes, we have just come to the end of the session, and yes, I was just going through your a lot of reels and health talks and podcast about the, very beautiful insight on clearing the myth and fact towards the epilepsy. Yeah, thank you so much for that, ma'am. And I urge all the viewers to just refer www.yashodahospital.com for more academic updates, health update, and also patient testimonials now. Because when you see things, then only you can learn and update yourself. As Madam said, there are types of seizures, and intervention for the same are very, very, safer nowadays. Yes, ma'am. Thank you so much for your productive time, ma'am. And I thank to all the speakers. You have any questions at last, you can always ask, ma'am. Otherwise, we end the session. Anything, Princy, Tripti, and Krishnaveni?
Nothing, ma'am.
Yes.
Already the topics ma'am
Yeah,
has
thank you,
explained
ma'am.
nicely.
And if at all you wish to post your questions or query in the comment box, you can do, and we will always reply to the same. And we end the session, ma'am. Thank you so much.
Thank you. Thank you for giving me the opportunity to talk.
Thank you, ma'am. It was very wonderful, ma'am. It
Okay.
was to the point and very wonderful.
Yeah,
Thank you,
yeah,
ma'am.
yeah.
Thank
Yeah,
you.
yeah. Bye-bye.
Bye
Thank
bye.
you, ma'am. Bye.
Bye.
Bye-bye.